Dr. Nishant, a curious case in emergency. He's a qualified medical professional with an MBBS and a fellowship in emergency medicine, bringing over 15 years of experience in medical practice, along with 4 years of specialized experience in first aid training. He's certified by the American Heart Association as an instructor in basic life support and advanced cardiac life support, and is also an advanced trauma life support provider certified by the American College of Surgeons. In addition to his clinical expertise, he actively conducts first aid training sessions for Directorate of Industrial Safety and Health certification, contributing to workplace safety and emergency preparedness. Apart from this, I would also say he's a wonderful human being. So he's also currently part of our diploma in mental health and counseling skills. So welcome you, Nishant, and thank you so much for agreeing to share your stories. I would love to listen. I do not know what this story is all about. Over to you, Nishant. Thank you.
Yes, thank you so much, Ranjita. And right at the outset, let me thank Ranjita and her entire team for actually inviting me for this particular session. When Ranjita called me, I was very excited. But when I called Ramya, I got slightly confused as to what kind of story I was going to share in the first place. So I'm already 40, so like a lot of experience I have, a lot of stories I could tell basically. But I did not know which all stories could be probably relevant in this particular platform basically. So I took a day and a half basically to come up with a particular story, and then I texted Ramya, "Okay, oh, this is the particular story I was probably going to share." And even within that particular day and a half later, also half a day, I took like this story or that story. Then I'm deadly sure that this is the particular story I'm going to share. So it was back in 2024 actually. I was working in the emergency department in one of the top hospitals in Pune. They have a very protocolized way of dealing with everything. So we were going to have a patient who was already informed to us. I was like on the evening duty basically. Evening is like 2:30 to 8:30, and that particular day we had a call like at 3 or 3:30 p.m. basically. There was this US lady, US citizen lady, and she was like around 78 years old. We already had a particular provisional diagnosis also in our call basically that she was probably diagnosed with this particular thing. We already knew as to what we were going to expect. So by 6:30, she was going to come. And we, being in emergency, is one of the, as Ranjita gave the basic life support and all of those things, these are basically related to how people can die different ways, basically as simple as that. So we were like usually prepared in different ways to how to save life. And the first thing that comes to our mind is basically if the patient is going to die or something like that. So this particular case was not like that. Although we had a confirmation that the diagnosis was made, but again we were like on our toes. Need not be any delay or any procrastination on our part to, in particular, dealing with this particular case. So we waited till like 6:30. 6:30, the patient actually did come. We got a call like 10 minutes back. We were around about to reach the hospital. She was accompanied by two ladies. And what happened was those two ladies were slightly reluctant to do anything related to that particular patient. They were not friends, to be very honest. They just knew that lady. There is one, I would not call it a cult, but probably that is the only one particular word which we can use for it. One particular religious thing that happens. It's like next to Pune only. I'm residing in Pune right now. It's a retreat of sorts, and they gather over there yearly. That particular period of time in that particular year, they were gathering over there, and it's a healing experience. It's nothing bad of sorts, something anything wrong. We should not be used about that cult, but they were there. They were living there. Unfortunately, what happened was for 2 long days, that lady was not attended, and she did not come out of that particular cottage house. And out of a sudden, they encountered that lady inside her room, basically lying down on the floor in a fallen down. She had fallen down basically. She was unconscious. So that they were scared in the first place that they had not taken good care of that lady, and they were like slightly worried as to what all maybe the consequences of that particular scenario would be. So initially they were like very reluctant to do anything. They were like waiting to just leave that particular premise, just drop her and then leave. that does not happen basically. So someone has to take the responsibility for the patient also. For the someone who is treating a person has to have the consent basically to treat anyone that shows up in the emergency. We have to do a lot of some things basically intervention wise. We have to be sure that the person who has been brought in, the relatives at least know, or someone who has been accompanying that person should know as to what is happening, and they should sign over there. Nobody was willing to sign. That was the tricky part for us. And she was from the US, and all of that excitement just died away right away, basically, because nobody was signing anything and nobody was willing to take any responsibilities. For like half an hour, we were discussing, literally discussing with those ladies, कि, "Ye wo karna hai, ye karna hai." They were like, no, no, we are not going to sign anywhere. They were like adamant about that particular thing. We are not going to sign anywhere. So we had to just discuss among ourselves also. We had to get involved the medical director of the hospital. We had to get involved the HOD of our department also. So many senior people we had to get, because this was a US particularly. That becomes a very big kind of a drama if we mess up this particular case, right? So eventually we got to the idea that we need to talk to the people who were accompanying that lady. And one of those ladies actually eventually ended up telling us that she had that DNR. DNR, I don't know how many of us know. Even I did not know prior to this particular scenario, but I had just an idea basically because I was working in the emergency. DNR is basically do not resuscitate. Do not resuscitate means you're not supposed to uh, do anything when the patient is about to die. So it's very popular in US and other developed countries. Not as popular in India, but it's actually picking up at this moment. But it's a very important thing. Even I at times feel that I would rather write a DNR basically rather than get those tubes and all over my body when I'm about to die. So this lady had that DNR signed, and the lady accompanying this lady told us that this was the case basically, and we could not just sign on anything if the daughter of that lady basically was not going to make consent for it. So we eventually made a call to that lady. We had to take like half an hour. We actually discussed with that lady's daughter basically in US that this is the situation and we had to do something about it. Then eventually the HODs and all of those people got signed. Those people signed on that paper, and we had to kind of start doing the treatment. All once we talked to the lady's daughter, then everything kind of got sorted, and we started doing a routine. So already half an hour or almost 1.5 hours, we were like delayed into trying to do anything into this particular scenario. So fortunately, when we got her into the emergency on the bed, basically she was vitally stable. Stable means her BP was okay, her pulse was okay, she was breathing, but she was not responding at all. She was not talking, and she was in her own world. What we use the term in medical fraternity is altered mental status, basically. So altered mental status is she does not understand what is going on around her, but she was awake, not aware, awake, but not conscious enough. I'll tell you the consciousness. There is a proper scale basically that we use to define physical consciousness. It's not just when it comes to different types of consciousness. It's a physical consciousness. We have a scale. That's Glasgow comma scale. It's like 15 by 15 is normal. Oh, and this lady was like showed like 12 by 15 or something like that, which is very low. Even 12 is not that good a number. But then we had to kind of go to the people who are accompanying her, and we started asking the history and all. That's when we got to know about this history that she had fallen down, and no, for 2 days she was not attended to basically, and they were like worried as to what all things would happen basically if this was going to go to the police basically, and this was going to go to the police. She had some bruises also. She had injuries on her body, so we had to rule out whether there was like physical assault or sexual assault also. Even the 80-year-old, no age is basically exempt from sexual assault. So we had to get those things basically cleared off in the first place. So we had to document everything. So we documented everything. In a way, we realized that there was no assault of sorts, but she was basically she had fallen down and she had all those injuries because of that particular fall. But she had injuries for sure. So the injuries could have caused a lot of pain to someone like us, basically, who was like conscious. 15 by 15 people would cause a lot of pain, basically. She was not in pain. That was the most curious thing for us. And while this drama settled, basically, initially we also had some quarrels also within our department, like emergency and ICU. Usually have a lot of quarrels, basically, what to do. So ICU HOD had called us and do this and do that, and we were not in a position to do. There was some quarrel, basically, but that drama settled down. And eventually, I personally got to into the documentation. All those people who were like more qualified than me basically were looking after the case, so I did not have to worry about that particular case in totally basically. So I was like doing documentation. Now, after everything that had settled down, I now went to the patient. And after going to the patient, it was something very, very unique thing that I encountered. As I told you, basically, she had a lot of bruises on her body. Even then, she was not in pain, and that was like very curious for us. Someone from medical field, probably if he or she will be seeing this video, would have some medical explanation. Even I know these explanations can be given. It's not as though these are beyond explaining these what, but that the particular experience that I had during that particular encounter is what I'm trying to share. And to be very honest, it's very difficult to kind of detach yourself from your feelings and what you're supposed to do. We have to do those things. You have to just be sure that the protocols are there. You have to follow those protocols in irrespective of what you're feeling at that particular point in time. I had this particular feeling that she was in a different state. We call it altered mental state, and there is an entire protocol as to how to deal with that particular scenario. So all these people were dealing with this particular scenario, and they left beyond the point. They put their orders and put their notes and all of those things. Now it was up to me and that lady basically, and the nursing staff also was there with me. I started talking to her, and I really, really found it very interesting that it was like what the way she was. I simply cannot act, to be very honest. And it won't be fair that even if I act on it, she was behaving like a 2-year-old kid who had like gotten out of a deep sleep and was very satisfied. It was that simple. That's the only way I could explain it. I went next to her. I was trying to talk to her. I was calling her name, and she was just looking at me. It was not as though she was not realizing the fact that I was next to her. And she looked at me, and she looked at my stethoscope. We have that around her neck basically. And she reached out to hold on to that stethoscope basically. So I gave it to her, and she was so, I don't know what you call it basically, and there is no medical term for it also basically. You call it alternate mentally, anything fits in basically. Whatever you want to just then explain, and everything is explained with those 3 words, alter mental status. But I was just trying to have this experience to what she was probably having inside her head, or maybe what she was experiencing. So she just held on to that stethoscope like a scientist. She was like looking at this from this point to this point, the entire tubing, then my earpieces and all. It was such a, I don't know how to explain that particular thing, but it's soothing for me to see that lady have that particular what can be called a sequence of events that was happening around me, and that was basically soothing me. She was not talking, she was not basically responding to anything. She was in her own world, as simple as that. But this was very, very unique kind of a scenario. Despite being in pain, she was not suffering. That was what I kind of concluded with. And this is totally non-medical experience I'm talking about. There is definitely some medical explanation to that. The diagnosis was there, of course. But again, whether we basically limit the entire experience to that particular diagnosis, or maybe we can just try and understand there is more to that human being. There is more to something which we probably could not see, and maybe she was experiencing that. At one point in time, we had a coordinator, brilliant coordinator basically, and she was handling it all. And she, up until a point, because this was a cult kind of a phenomenon, they were like cracking jokes about it. So there are certain people who like non-religious stuff, like they are like having that particular mindset that just keep mocking of those. But they were not mocking her basically, but that idea was something like kuch to religion se related. So they were like having that particular discussion among themselves. I basically intervene. That 15 by 15 is very interesting. Basically, 15 by 15 is like 100% conscious. I ended up, it's not something I make up every single case. Huh? It's very, very interesting. Usually that score is necessarily lower than 15 only. Always lower than 15. 15 is the highest. I ended up, instinctively, I ended up calling it out like it's 16 by 15 basically. It's slightly higher than what we are probably here. It's not sure, it cannot be proven, it cannot be, there was no evidence, to be very honest, to whatever I am trying to say. But the way that particular experience that I was having, the way she was looking at that stethoscope and the way she was looking at me, it was like very, very revelational for me. I never realized that the person, she was not dying, of course, but she was not 100% okay also. What we understand when it comes to a diagnosis or maybe a disease, for example, we attach by default suffering to it. Unless a person is suffering, we don't call it a disease. डिजीज का डेफिनेशन ये वैसा रहता है बेसिकली कि डिजीज इज डिस-ईज, डिस एंड ईज. If you are not at ease, then it's a disease. She was diagnosed with a disease. She had bruises. She had a lot of things which were causing her pain, and she was not suffering at all. That that was like totally different experience for me altogether. Someone who has worked in the department of forensic medicine, even we are like carrying out postmortems also. So postmortems is a very different ballgame altogether. We are like trying to find out reasons for why people died, and there are various reasons people can die for. This was a particular case where this person was in a totally different mental state altogether. I don't usually I don't would not have said this, but I would not have minded if probably this lady would have died in a day or two. I don't know if this was affecting this lady at all. Whatever she was into, it was affecting her at all. And the fact that she had signed the DNR, in the retrospect, we were discussing basically why would someone sign a DNR? It's like lesser pain is, I can totally understand. Like, I don't want that pain of like putting tubes all over my body and then injecting injections and all of this. Just trying to push a person to survive basically is not something even I would probably go for. But there are certain things like this particular religious cult and all of those things, those experiences, and this particular experience that I was encountering basically. I had this particular feeling again that this was a special experience for me basically. And then again, beyond this particular case, she was admitted in our hospital for like, I think for 15 or 16 days. And I went to visit her on the fourth or fifth day. I actually, probably on the 10th day, I ended up resigning from that hospital. But on the sixth or whatever day I had actually gone there, she was in the same state. She was like trying to be resuscitated. She did not need any resuscitation. Basically, she was doing well. The way she was in the hospital the day we received her, she was the same basically. But she was surviving. There was no, again, vitals were all good and all of those things. She was like fed through IV medications only, like saline message aa raha tha pura wo. But that was a very unique experience for me. I don't know how I could have narrated it any differently basically, and this is my first experience, to be very honest. But that's probably it. And if you encounter such a thing in the future also, if someone is not suffering, then it's not a paradoxical thing. Is all I'm trying to understand. It's not a paradox to see people who are like diseased and not suffer. It can happen basically. This is my experience. That's probably